Hello, thank you for taking the time to listen to this orientation session on the Florida Family Leaders Network. I hope you find it useful as you think about attending the FFLN Summit on September 24th. My name is Angela Miney. I am the family partner with the University of Florida Pediatric Pulmonary Center, and I am the coordinator of the Florida Family Leaders Network, which we typically refer to as the FFLN. My overarching goal for today is to give you an orientation to the FFLN. There may be some of you who are listening to this who have attended one of our summits in the past, who are perhaps on our Facebook group and are just interested in reminding yourself as to what we are all about. And I welcome you. I also want to welcome those of you who are completely new to the FFLN and who will be attending our summit. And I hope that this reasonably short presentation will give you a good overview of what we've been doing over the last couple of years and will help to make a lot of sense about some of the things that you'll hear at our summit on the 24th. Specifically, I want to define the principles and the definition of patient and family-centered care that guide family professional partnerships and specifically ground me in the work that I do. I want to tell you a little bit about where family youth leaders are engaged in family professional partnerships, suggesting some examples that you may have come across locally, some more institutionalized partnerships in Florida, and then just mentioning a few that are available nationally. And then I want to describe the FFLN, which I see as a model that can be replicated in other states in the country. Just a moment on definitions, because I realize that I talk about these things very interchangeably as I explain the FFLN, and I want you to know what it is I'm referring to when you hear me referring to a family leader or a champion or an emerging professional. Family youth leaders, or sometimes we refer to them as family partners or advocates, essentially they are people who all have children with special healthcare needs, or who in many cases are themselves youth with special healthcare needs. And as leaders, what they are now doing is using the lived experience and the expertise that they gained in taking care of themselves to now work on behalf of others. So some of those partnerships take place on a one-on-one basis, but more often, and what I want to focus on, and really what the FFLN is focused on, is really systems level change and how we can, as family leaders, we can bring about change at that systems and institutional level. I like to refer to the professionals who support us in this work as our champions, because quite honestly, we couldn't do this work without them. And of course, our emerging professionals, many of you who are listening to this, you're the next generation of clinicians who will be serving our children with special healthcare needs, and we will depend on you to carry on this work. So who are children with special healthcare needs? And of course, we may be familiar with the acronym CYSHCM. They are defined as children who require services beyond those that a typical child taps into. So that's about 20% of the population of children in the US. And when I talk about children and youth with special healthcare needs, I'm including children with disabilities, medical complexity, and chronic illness in that. And so we sort of use this phrase, children and youth with special healthcare needs, to try and encapsulate all of our children within that definition. Why me? As you can see on the screen, you can probably guess that these are photographs of my two girls, and my younger daughter Catherine was diagnosed back in 2002 with what turned out to be a very complicated form of juvenile arthritis. I'm happy to say that she has done well and has now transferred her care out of Florida, and she lives out west and is continuing to get care for herself and is very independent. In 2006, based on the experiences that I was having at UF Health, I was invited by the University of Florida Pediatric Pulmonary Center to share my lived experiences of going through the healthcare system with Catherine and the challenges that it presented, and really trying to bring my perspective to an interdisciplinary team. So let me tell you a little bit about pediatric pulmonary training centers, or PPCs as we refer to them. They are funded by a federal grant from the United States Department of Health and Human Services, specifically through the Maternal and Child Health Bureau. There are 6 of them in the country. As you can see from the map, there are 4 of them out west, and then 2 on the eastern side of the country at the University of Florida here in Florida, and then the other one on the east coast or eastern side of the country is at the University of Alabama in Birmingham. And we are charged with training the next generation of clinicians who have an interest in pulmonary medicine, or when they come to us, they think they have an interest in pulmonary medicine, but actually as pediatric pulmonary centers, we are trying to bring a much broader public health perspective to what is their clinical experience, and we are charged with giving them training that is interdisciplinary, family and patient centered, and is culturally competent. Let me move on from there. Oh, yes, the other thing that I wanted to mention to you is very important that each pediatric pulmonary training center is encouraged to have a paid family partner. And I mentioned to you on the previous slide when I was talking about my own experience that initially I was invited to come and share my experience of healthcare with the pediatric pulmonary faculty and trainees. And over the years, I have been invited to increase that engagement, and I actually now do have a paid position with the PPC, and my charge is to bring the family perspective. I don't have any other medical background other than that gained by going through the healthcare system with Catherine. So within the state of Florida, the other Maternal and Child Health Bureau funded programs are at the University of Miami Miller School of Medicine. There is the LEND program, which is Leadership and Education in Neurodevelopmental Disability. And at the University of South Florida in Tampa, within the School of Public Health, there is the Center of Excellence in Maternal and Child Health Education, Science and Practice. And we are strongly encouraged to collaborate with one another, but we are also very strongly encouraged to collaborate with our colleagues at the Department of Health, specifically within Children's Medical Services and within the Office of Children with Special Healthcare Needs. And that will be significant in a couple of slides when I kind of describe to you how the FFLN came about. But one thing just to draw your attention to on this slide is this map. And you can see that Florida, as you well know, is a really big state, and our programs are very spread out all the way from Tallahassee all the way down to Miami. So unlike, for example, our colleagues at the University of Alabama in Birmingham, where on their campus, there's actually a PPC, a School of Public Health, with an emphasis on maternal and child health, and a LEND program. We're very much spread out all over the state, and we work harder to collaborate with one another. Switching gears a little bit now to talking about the principles that particularly ground me in this work. And you may be familiar with this image of two people doing what in fact is a tango. And for those of you who are familiar with it, you will know that it is a work of art, and it's very complicated. And when done properly, it is really beautiful. And so it kind of describes family professional partnerships, because the work isn't easy, but when we do it well, it really brings great results. This is the definition from the Institute for Patient and Family Centered Care of PFCC. And as you can see, it is an approach to healthcare that is grounded in mutually beneficial partnerships. And I want to emphasize that word partnerships, because within a partnership, there are responsibilities for all parties within the partnership. And so for any of you who have taken part in any professional education that describes patient and family-centered care, and if you are what I would describe as a professional or a champion, you may be familiar with these core principles, and people directing them very much at you and suggesting that this, to be successful in bringing about patient and family centeredness, that you need to change your behavior to reflect these core principles. As a family leader, I also believe that if I want to partner with you, that I am also bound by these principles. And so as I just run through these 4 core principles, I will tell you how they relate to me and my work. So dignity and respect really means honoring the perspectives and choices of people within the partnership. And at this systems level change, within that arena that we're talking about, I believe that I need to listen respectfully to what you have to say. I am engaging in this because I understand that you are going to listen to me and my perspective, and that when we put it all together, that we will achieve change and worthwhile change. And as much as I ask you to acknowledge my cultural beliefs and background and the expertise that I bring, it's also important for me to honor the expertise that you bring to this relationship. And when we do that, as I said, that allows us to participate and to work together. And when we talk about participation, we're really talking about bringing about change kind of on a one-on-one level. So I may work with one provider or with a very small group, and not necessarily bringing about big systems change, but maybe just doing things on an individual basis. But when we talk about collaboration, we're really talking about change at an institutional level. So whether that's within a clinical program or within a Department of Public Health, or whether it's within a private foundation. So it's really, engaging patients and families and their expertise and their lived experience in that policy change, program development, research, in facility design, and of course in professional education. So let me switch now to just telling you a little bit about where I see family professional partnerships in action. Locally, some of you may already be familiar with advisory councils within the institutions that you work. Advisory councils are very popular within healthcare organizations. And essentially an advisory council is a group of stakeholders, so patients or family caregivers and professionals and champions who come together to tackle issues that are particular to that institution. The next place where you often see patients and families engaged is on particular committees. And in my own case, for example, we have done some quality improvement work at UF Health, and I have been asked to be on various committees where I'm the only family member or caregiver on that committee. So unlike an advisory council where you would have several family advisors, when typically on a committee you would probably only have one or two, but there to bring my perspective and my lived experience. Often, certainly as emerging professionals, you may have experienced family faculty sharing their lived experience. And for example, at the University of South Florida, I know that Christina Ortiz shares her experiences with her. And for those of you who have maybe been around a little bit longer, Joanne White for many years was also the family faculty at USF. In many organizations, you will see family leaders being in a mentorship, a very formal kind of mentorship role for other families with children and youth with special healthcare needs. One of the roles of the family resource specialists at Early Steps is this mentoring role where the family resource specialists have expertise because they are all the caregivers of children with special health care needs, and they work to help other families who are new to the experience navigate the systems that serve their children. And then, similar to myself, there are many and increasingly more staff positions for family leaders where we work alongside other professionals within organizations. So very specifically at the Department of Health, Children's Medical Services, they don't do anything now without engaging with families, engaging the youth voice, and that voice is just a perspective that joins with all of the other voices that are offered in terms of preparing their block grant application, on various work groups, focus groups in their quality improvement, and in this initiative of developing the Florida Family Leader Network. Many of you will also be familiar with the Family Network on Disability, which is the Florida chapter of Family Voices, and the work that FND does in terms of education, training, and support. And you will also be familiar with many of the people who present and work with FND, who again are sharing their lived experience to help people who are trying to navigate the systems. And within Florida, Family Cafe is also an amazing organization that has grown over the years as the children of the people involved in Family Cafe have grown up and have grown into adulthood, and the organization has just grown with them and provides space for dialogue and advocacy and partnership. And then just really briefly, this is a list of organizations within the country where you will see patient and family engagement and very successful family partnerships. And for those of you who may have a particular interest in research, I would suggest to you that you check out PCORI if you're not already familiar with them, the Patient-Centered Outcomes Research Institute, which is doing, how do they describe it, bench to bedside research, and do nothing without engaging with family and patient perspectives in that research arena. Okay, so let me tell you about the Florida Family Leader Network, or the FFLN, and I'm happy to share this photograph with you, which was taken at the end of our summit in 2019. And of course, I'm sad that we can't get together in person this year, but as of course, as you know, at this point, pretty much everything this fall is being offered virtually, but happy to say that the upside of having a virtual event is that we are able to accommodate more people in a virtual event than we are in an in-person event. But you can see lots of smiling faces, and this was at the end of our 2 days. And what you're not experiencing is kind of the passion and the energy in the room at the end of our summit, but hopefully you will experience a little bit of that on the 24th. So just coming back again to the MCH funded programs, I mentioned that there are 3 programs in Florida who get similar funding. We're very much encouraged to collaborate with the Florida Department of Health Children's Medical Services. And it was at one of our meetings in 2016 where we talked about this idea of family professional partnerships and really, you know, how we could kind of work better together and also tap into what turned out to be a lot of family leaders within Florida who were not connected with one another, and we felt that we really needed to create this network to bring all those voices together so that we could share best practices, but also learn alongside one another. Because one of the things that came out of this meeting, and you can see a picture kind of tells a 1,000 words. You can see that this was a much smaller group in 2016. It comprised mainly faculty and trainees from the 3 programs and from the Florida Department of Health. But there were some family leaders who attended this meeting who were from external or other organizations. And what really came out of the meeting was this hunger for us all to stay in contact with one another, support one another, that really family leaders, because they're not typically found in organizations, or not in numbers anyway. So for example, each Early Steps office has 1 family leader. For example, I'm the only paid family leader at the University of Florida. So you see that there's, you know, we're not like nurses that are, there are multiple people working in organizations. So there was a sense of kind of loneliness, or we were working in isolation, and the FFLN emerged from that as a way of addressing that issue. So really our overall mission is very broad, and it is to collaborate with one another and to advocate for person-centered care. But really, you know, for me, the goal is to break down those silos that continue to persist both in education, in health, in community agencies, but all of those agencies that serve our children with special health care needs. You know, we've all experienced it, where sometimes, you know, you get off the phone and you think, does the left hand not know what the right hand is doing? Our organization's not talking to one another, and so, you know, you become the case manager and the linchpin really for your own child. And there is so much that we can learn from working together. And if we advocate also to break down these silos and share all of the information about our children across systems, that obviously we will achieve better outcomes. So our goal is really just to try, as family leaders and those who support us, is to break down those silos. So the membership of the FFLN mirrors those definitions that I shared at the beginning. So we are made up of family leaders and family partners, and increasingly we are trying to include the youth voice more and more, because we of course all realize that the youth are very active, and as they come into their teenage years, many of them find their own voice and want to share that and want to help others. And so we want to try and facilitate networking the youth together as well. And of course, as I said, we have the professionals who support us in this work, our champions, and increasingly the emerging professionals who are the next generation. And so that broadly defines the people who are the members of the FFLN. And the thing that sort of binds us all together is this notion of family professional partnerships, that as families and youth leaders, we want to bring our perspective to bring about systems change. And as champions and emerging professionals, you want to hear from us so that we can make the systems better. This is just another map. I love maps. I'm very visual, I think, and it just helps to show you that we have representation from all over the state of Florida. Obviously, the more populated urban areas have more representation than some of the more rural areas, but as you can see, we have a good smattering of representation across the state, and even a little bit beyond that. And these are just the organizations that have been associated with the FFLN, either by sending representatives from these organizations to our annual summit, or just people coming from these organizations who have heard about us and have tapped into our network and share their expertise with us. And as you can see, we are truly across the academic medical centers. We've got a couple of private foundations in there. We have community agencies and the clinical programs across the state. Our membership has grown since we started seriously, I suppose, back in June 2018. After that 2016 meeting, it took us about a year to really sort of get our thoughts together on what this network, as it's turned out to be, what it would look like. And we had our first summit in September 2018. And our numbers have grown slowly, but it really grows by word of mouth. And I think that this has been the best way to grow it in one sense, because it's me talking to somebody else that I know who is passionate about the same work that I do, that that person is going to be a valuable member of the FFLN, and then they're going to encourage other people in their networks to join us as well. So it's really spread by word of mouth. And as you can also see, we are about 2/3 family youth leaders, and then the other third is made up of champions and emerging professionals. And this is reflective of a best practice within the arena of patient and family-centered care. So what do we do? Well, what we do is we network, and as I have said earlier on, and maybe I don't emphasize it enough, to me, the networking is really the most valuable thing that we do, because there is a lot of expertise just in the state of Florida, for example, around family professional partnerships. And we don't want to reinvent the wheel, so we need to be able to tap into that expertise. So we do that. We have a private Facebook group. We also have a listserv that we communicate with our members through, and then we have our annual summit. More recently, we have also developed a website which gives you more information about the FFLN, and I've included the link to the website at the end of this presentation. And the other thing that we do is we want to learn together to be better leaders. And it's important that professionals, champions, emerging professionals, and family leaders work together and learn together, so that we we share our expertise, and but we're also becoming better leaders and can more successfully participate in family professional partnerships if we're all hearing the learning together and from the same source. So we do that by, so at our summit, as you know, if you've looked at the agenda, we have some very exciting speakers for this year, both local and national, who will share their expertise in terms of family leadership, resident leadership, cultural humility and cultural resilience. And then throughout the year, then we also do some educational webinars uh, that are geared both towards family leaders, youth leaders, but also towards professionals as well. And for example, we on our website, you will see resources or past webinars that we have done. I would particularly draw you to our 5-part series on compassion fatigue, and that webinar is, or series of webinars is archived, and you will find it on our website and you can look at it in your own time. And then, you know, again, going back to the networking and the supporting one another, this work is hard. You know, we've all seen over the last few months how COVID has impacted our lives. It has had a big impact on how family leaders and youth leaders can continue to engage with systems to bring about change. And there is actually a really good discussion planned around that for at the summit in the afternoon, and I hope you will take part in that. But we need to support one another because this work is kind of hard. So what can you expect at the summit? Well, we're going to learn together, and as I've already told you, we have a national family leader speaking. We're going to talk about your personal values and resident leadership. We'll talk about cultural resilience and humility, and then you'll have the opportunity to discuss the future of family professional partnerships. But we're also, even though it's hard, we're going to give you a couple of opportunities to network with one another and to meet other people who are as passionate about this work as you are. So just my final thoughts. Family leaders, youth leaders, people who are engaged with taking care of children with special healthcare needs, we just see things through a different lens. We're not saying we have all the answers. All we're saying is that we bring a perspective that we would like to share that hopefully will bring about more effective change by incorporating our voice. This work is hard. Many of you know that already. There are no easy solutions, but if we work together, we'll get there. And I know that the people who are currently part of our network, that we are working really hard to give our children the best possible chance. That's our guiding principle and our goal, and we just want to be part of the conversation. And I've just noticed on this slide that Catherine Miney is peeping over her own head. Not quite sure how that happened, but there's only one of her. I can safely say that. So welcome to the FFLN Summit 2020. And I'm so looking forward at some point to meeting you in person, but this is the next best thing. As I said, you can learn more about the FFLN at our website, www.floridaleaders.org. You can by all means contact me if you have any questions. There's my email address, my phone number, and I will look forward to seeing you on September 24th. Yes, the 24th. Thanks for listening.